The fire hose of news from America can feel like a lot these days.
If you're trying to figure out what to make of it all, we got you.
I'm Katie Simpson.
And I'm Paul Hunter. We're correspondents here in Washington,
working just around the corner from where much of the action is taking place.
2 blocks from the White House.
And that's the name of our new podcast.
For top-notch analysis of U.S. politics from a Canadian perspective, find 2 blocks from the White House every Wednesday wherever you get your podcasts.
Including YouTube.
Frequency Podcast Network. Stories that matter, podcasts that resonate.
It should be an exciting, joyous moment, giving birth to a newborn baby. But for a Black woman, bringing a life into the world comes with a higher risk of losing her own. Black women in the United States and the United Kingdom are 3 to 4 times more likely to die in pregnancy or childbirth than white women. But what about here in Canada? In a country that prides itself on equitable access to healthcare, limited data shows that is not the case for Black mothers and mothers-to-be. I'm Tammie Sutherland, and today on The Big Story, we're talking to Kearie Daniel, the executive director and founder of the Black Women's Institute for Health, to discuss the maternal mortality rates among Black women and what Canada is and is not doing when it comes to data collection. Thanks for joining me today, Kearie. I really do appreciate it on a topic that is so important, but often isn't spoken out loud in certain spaces other than within the Black community or within a community of women who have been dealing with similar issues. So when we talk about those Black maternal mortality rates, we see data coming from the US. We see data coming from the UK. Let's start there for now because it's a bit more conclusive when it comes there. What can you tell us about those rates?
Mm-hmm. You're 100% right in the sense that, a lot of these conversations are kitchen table conversations, right? That we're having as Black women, with friends, with family, with aunties. What we know from the data that has been collected in the United States and in the United Kingdom is that Black women are experiencing the healthcare system when they go, whether they are pregnant or not, quite frankly, but when they go in to either deliver or they're getting care for pregnancy in a way that many others are not. We are dying at higher rates. Our mortality is higher. The outcomes are more complicated. Our children are often not living, right? Like we are experiencing the system in a way that many others are not experiencing it, and in a way that is detrimental to our own health and the well-being of our families.
And what about here in Canada? What do we know about Black mortality rates when it comes to women within the healthcare system, but particularly mothers and mothers-to-be?
Our mortality rates are, we know very limited information on Black mortality rates. Even within the Voices Unheard survey, we're looking at the social determinants of health, and absolutely maternal health and well-being was part of that. But even then, what we know is anecdotal. So it's the same story. We know that across the board, Black women are experiencing higher mortality rates when they go in for delivery. They're experiencing adverse complications. So higher rates of C-sections, for example, is something that we see with Black women here in Canada. As well as higher negative outcomes for their children. The other piece, too, is complications with pregnancy. So things like gestational diabetes, we often see. There are, I would say, stories or at least a narrative about non-compliance with Black women when it comes to things like managing gestational diabetes. But what the system is not taking into account is that, you're asking women with a particular cultural heritage or need in terms of the foods that they're eating to comply with a diet that does not work for them, right? So the system itself is not being responsive and inclusive in terms of its design. And so you have situations where, a Black woman may come in, they may present with gestational diabetes, but they're not able to actually follow the diet that is presented to them because it doesn't make sense for them in terms of the foods that they eat. So we really need a system to be inclusive of that and to really think through what we are asking of not just Black women, but all racialized and Indigenous women as well, in terms of how the system is designed to react to us, right? The other thing we see with Black women across the board, whether it is maternal care or just generally, is access to pain management. So, we're seeing things like um, Black women are not, there's this myth and idea that Black people have a higher pain threshold. That comes from eugenics. It is anchored in our history of enslavement and colonialism and the exploitation of Black bodies. And it is still anchored in our medical profession today. We see that. So, Black women who are pregnant, who are birthing, have told us, that they have been delayed care in terms of access to pain management, access to an epidural. We've had one of our Black women actually who launched the survey with us. Her story helped launch the survey. She spoke to us at length about the fact that, when she delivered her baby, she was in excruciating pain that was not normal after the fact. And she was very vocal about that, but was told she could handle it, was not given pain medication. And in fact, a social worker was sent to see her after, which brought in, and there was no need for a social worker. She wasn't in need of anything. She had a supportive family and partner. She had a great job. There was no need for the social worker, but it brought in this extra layer of an additional system into her life, with the potential of her child being taken from her, simply because she was in pain. She was asking for that pain to be managed. It wasn't being managed, and there were all kinds of assumptions that were made about her, and why she was seeking pain management.
Now, you talk about the survey, and I want to get into that as well. Voices Unheard, a survey that the Institute launched last year and published last year. And I want to get into some of the reasonings why you thought this was an important survey to take. You talk about that story being one of the things that spurred this. Tell me a little bit about what you wanted to do with this survey and what it has shown so far in the results.
You know, the reason this survey is so critical and so important is because it is the first time ever in the history of this country that Black women have been called and counted. It's the first time that Black women have been asked what their experiences are. If you think about that, it's shocking, right? That in the entire existence of this country, we have never thought to find out how Black women are doing. Black women are the backbones of our communities. It doesn't matter what part of the African diaspora we are from. We are the holders of our communities. And so if we're not doing well, our communities are not doing well. And if you don't ask, you don't know. You measure what you treasure. And if you're not measuring, data is so important. We collect data on everything, right down to the millisecond that you spent. How much time have you spent on a certain app? You can find all this information, but yet we just haven't been able to find information about Black women's experiences until now. So that's why we wanted to do this. We knew that there was a gap, we met with Statistics Canada. We met with all kinds of national organizations. Nobody had this information. And so it was us as this little tiny, nonprofit that has gone ahead and collected this information for the first time. The only way in which we're going to make change is through data collection, through understanding the data, and then working to change it. So that's why it's significant, and that's why we wanted to do the work.
And some of the background on this survey. So Voices Unheard, it's Canada's first national health survey focused on Black women and girls. You surveyed almost 2,000 people in this poll, and you were able to get some information and results that are quite staggering. The survey showed that there were 67% of people who were surveyed said that they felt their health concerns were dismissed. not taken seriously by a healthcare provider. 42% said they delayed seeking healthcare, as you had mentioned, because of the fact that they faced barriers before in the healthcare system. Now that you've published those survey results, has that garnered any attention or reaction from whether it be the federal government or the provincial government to start some action so that we can make change when it comes to this?
The survey was well received within community and within community agencies. It hasn't garnered the attention of our governments in the way that it should. So we have had some traction provincially here in Ontario with our official opposition party, the NDP party, where there is interest in understanding the data and looking to see what aspects of the recommendations they can drive forward. But this is not a partisan issue. Health is not a partisan issue. Um, this is an issue that all parties should be interested in. We are in crisis. You cited some of those numbers. 42% of Black women have told us they have delayed or avoided seeking treatment because of fear of how they should be treated or how they would be treated if they go in to see a doctor. We have a universal healthcare system in this country. That doesn't mean it's equal. That doesn't mean it's fair. And so that is definitely something that we need to address. And if we have a universal system that is not equitable for all, it's a problem, and we should be addressing it because, the fact that Black women are delaying care, delaying treatment has huge implications for them, but also for their families, for their communities, because we know the importance of early intervention when you have medical issues. We know the importance of, screening and, just making sure that you're addressing these medical concerns early. And if we're not doing that, we know that's partly why outcomes are poor. It's also why we are dying. And it is something that is reversible through things like training, through making sure that our doctors are equipped to work and our clinicians are equipped to work with Black people and Black communities.
Why do you think there's a hesitancy to collect race-based data here in Canada officially?
I think that people are afraid to ask the question. And there's a misunderstanding, a misconception about the fact that um, it's almost like they believe they're being rude by asking. And that couldn't be further from the truth. I think it is excruciatingly rude not to ask. We're the only Western country that it does not collect race-based data in this way. The United States is, you know, way ahead. The United Kingdom is way ahead. I remember I lived in the United Kingdom for a number of years, and I remember I was young at the time, and I remember going in to get a library card and them asking race-based information. They wanted to know my race, they wanted to know my ethnicity. And this was like over 20 years ago. And so even in something as simple as that, who is accessing our libraries? Who is using it? Who's not using it? Where do they live? Where are they coming from? That information serves to enhance the library system. And it's the same thing here. If we are not measuring race-based data in even wait times, we measure very carefully wait time data for our emergency rooms. But what does that look like in terms of, breaking it down by race? Like, how do we know that some people are not waiting longer than hours? How do we know that than others, right? How do we know that the system is actually working in an equitable way? We don't. And so you can't operate. It doesn't make sense. It's actually not even scientific to operate in the dark like that. We need this data. We have to get past this fear of asking the question or of offending people. Once people are educated on why we're collecting this information, they'll give it to you. And we saw this in this survey. To get 2,000 women, Black women, across this country to respond is unprecedented. Based on our percentage of Black women in this country, we only needed about 354 responses. We got 2,000. And we saw it in the story. So, we got a lot of numerical data, but we also had women just writing pages and pages and pages about their experiences because they wanted to tell us. They want us to know. They recognize that, I have to share my story in order for things to get better. So absolutely, we need to be doing a better job at collecting data, and it needs to be enshrined and embedded in every aspect of our healthcare system and our adjacent systems as well.
Do you think there's an element of not wanting to confirm the problem that lies behind the hesitancy?
I think that it's one of those things that what is seen cannot be unseen. And once you know, you have to do something about it. And I feel that when we present this information, there is this kind of shocked belief. I'll give you an example. So you mentioned two data points which were quite surprising, which was the 67% of women, Black women telling us they felt dismissed, 42% delaying or avoiding care. But the other number that was excruciatingly difficult to see was 27% of Black women told us they had thoughts of self-harm. 27%. That is over 1 in 4. And it is 7 times higher than the national average. That is a number that you cannot ignore. These are people, the Black women that completed our survey, the top 3 professions were education, healthcare, and nonprofit work. These are people we are caring for our country. But 27% of us are saying we have thoughts of self-harm. That's a number where once you see it, you cannot unsee it, and it forces the system to respond. So I do think that an element of it's almost like not wanting to recognize it, because it's then, well, the question becomes, well, what do we do? And it's another thing that has to be dealt with, but it's urgent and we can't close our eyes to it. We've been ignored for too long. We've been invisibilized in this country as Black people and as Black women in particular, Black women and girls, for far too long. It cannot continue like that. And the hope with Voices Unheard is that it does bring these conversations to the forefront so that we can see the change that we need to have.
You talk about people wanting to share their experience and writing, pages when responding to the survey. I am just freshly back from a maternity leave, and I had a baby in December of 2024. My second. I was induced, didn't really want to be induced, but was induced for hours and hours on induction medication without anything really happening. They were aware of my age. I'm considered mature. They were aware that I deliver very quickly because I had my daughter without any pain medication, because I kept calling to say, I think she's coming. And they told me, she's not coming. It's okay. And I got to the hospital and she was born 10 minutes later. I was already fully dilated by the time I insisted on getting myself there. But this time around in December 2024, we got there early. I was on an induction medication and I gave birth. It was soon after that, with them knowing all of those factors about me before, that I hemorrhaged, to the point of losing about half my blood supply. Transfusion after transfusion, spent 3 days in ICU. Never held my daughter until I was well into ICU. I held her for the first time while I was in ICU about 24 hours later. And so when I heard, when I hear these stories, I think back to that day and that time when myself, my sister, we went online trying to find information on postpartum hemorrhage and some statistics. They made it seem as if it wasn't there was a 2%, I think, occurrence rate that we could find online. But then when we started sharing the story just around the table, woman after woman after woman said, yeah, me too, me too, me too. So do you find then that when, as you talked about that kitchen table kind of feeling where we sit down and we talk, do you find that people are are more apt and encouraged to come out with their story once someone else does? Is it a matter of that, or is it a matter of, listen, I just want to be able to tell this to somebody who will care?
I both those things. I think 100% people are more likely to come out once they hear a story, and I'll tell you about that in a minute. But I want to just validate your experience and say, I'm sorry that you experienced that. I think as a Black woman, it is a miracle to go into any healthcare facility in North America, and come out with a baby, because we are at a risk. I also experienced hemorrhaging, not to the extent that you did, but enough where I was, I was begging to hold my baby. They wouldn't give him to me. And the doctor said, I'm trying to stop the bleeding. And that was the only reason I knew I was hemorrhaging. Um, it begs the question, if we looked at data around, you said 2% of women experience hemorrhaging, but what about Black women? So if we break that down and disaggregate the data and look specifically at Black women, maybe it's 30%, maybe it's 40%. We don't know unless we ask and we look. And if it is that high, you know, w- we should be addressing it. We should be trying to figure out, why are Black women hemorrhaging in that way, and how should the system be responding to that? If you think about, when we ask Black women the chronic diseases that they are currently dealing with, the top three was mental health, which we did not expect, hypertension, which we kind of expected, and fibroids, which I knew was high, but I wasn't expecting it to be in the top three. But it was in the top three. And, I can't walk without meeting a Black woman who doesn't have fibroids. Yet we don't have enough research on it. The treatment care for fibroids is not great. It has such impacts on our life, and even our ability to carry children. But there isn't a lot of study around it because it's something that so affects Black women, right? And so even within that, you can see how medical racism plays a role, even in the curiosity of trying to figure out what is going on here. Nobody's asking the question because there is a limited expanse to our humanity when it comes to us as Black people, as Black women. And then you ask the question about stories, and are women more willing to share when they hear? Absolutely. I think that why our survey got such a response was because we had three brave Black women who came forward and started this process with their own stories. One spoke about her experiences in mental health. One spoke about her experiences in the education system and navigating sexual assault and the justice system. And another spoke about her experiences as a Black mother and navigating the system, the maternal health system. And that really opened the door for women to share.
Lastly, Kearie, I want to ask you about an initiative that the Institute has started when it comes to providing that community. It's called Mothering Minds. Can you tell me about that?
Yeah, Mothering Minds, it's really a recreation of the village. Um, you know, it's a very Western practice for family, for that idea of the nuclear family, and kind of like families to isolate around motherhood. Many, many other cultures don't do that. That kind of idea of the baby bubble, and you and your little, like your partner or whoever, like you're in this, that's very Western. And it often leads to a lot of isolation and a lack of support. And the problem with that when it comes to Black mothers in particular is that if you do not have that support and that network around you, you are more vulnerable to other systems like the child welfare system, irregardless of your socioeconomic status. Absolutely, women who are lower socioeconomic status have higher, touch points with systems like the child welfare system. But it actually doesn't matter. Like, we also, regardless of where we sit in that continuum as Black women, we're all vulnerable. And so Mothering Minds was really designed to kind of recreate that village, to provide support for Black mothers, no matter where they are on their mothering journey. So we've got moms in there who have newborns. We have moms who have, adult children, and they're trying to navigate their adult children, and they meet monthly. It is therapist led but peer driven. The therapists every month they'll present a different kind of learning topic. So it could be something like, I don't know, dealing with big feelings and moods with your teenagers, or it could be navigating the education system, or navigating the child welfare system, whatever that is. And then after those presentations, after a bit of learning, then you can go into the group that you choose. So if you've got 3 kids and your 8-year-old is the one that's acting up this week, and you really need to talk about that, you go into the group with the school-age children, and you let loose. And you've got mothers in there that will commiserate with you, that will give you their feedback, that will share. We had one mom who talked. She said when she first started, she was very quiet and she didn't share very much. But there was one day where she had to hand off custody of her child. And she said she just came and someone asked her how she was, and she just burst into tears. But she said that the group held her so closely, and they even checked up on her, that it really gave her this sense of community. And that is what we're trying to build. We're really trying to build that network where you can lean on people, because that is what's going to improve your mental health, improve your ability to parent effectively, and improve your relationships with your children as well.
All right, Kearie, we appreciate your time. Thank you so much for this discussion and for your insight and for calling for this data collection so that we know exactly what we're dealing with robust information here in Canada, hopefully leading to improvements for Black mothers and mothers to be everywhere. We appreciate your time, Kearie. Thank you so much for talking to me.
Thank you very much for doing this.
And that was The Big Story. We'd love to hear your thoughts on this conversation. Send us an email at hello@thebigstorypodcast.ca. Reach us on Instagram @frequencypods, or on Blue Sky @thebigstory. If you know someone that might enjoy this episode, be sure to send it to them. You can listen to The Big Story every day on the Seeker app or wherever you get your podcasts. I'm Tammie Sutherland. Thanks for listening.